I am Bon Ku. I'm a physician, so I work in the emergency department.
My name is Paula. I am a registered nurse.
My name is Sarah Belko, and I'm a med student between my second and third year of medical school.
My name is Julia Hennessy, and I am a registered nurse.
As a physician, I see injustices every day when I work in the emergency department. I like to ask my patients what neighborhood in Philadelphia that they're from, and I have noticed this trend in the over a decade that I've worked in the emergency department that the sickest patients tend to come from our poor zip codes in our city. If you live in the zip code of Strawberry Mansion, for example, your lifespan is 68 years. And then if you live in a zip code in Center City in Society Hill, lifespan is 88 years. And to me, that is the most inequitable data around humans, that where you live predicts your lifespan. And to me, health equity means changing that lifespan gap of creating, how might we create those conditions so that someone who's born and lives in the zip code of Strawberry Mansion can live as long as another human born in another zip code of our city.
How can we all be better at health justice? I think listening, like I said, right? Patients have a story to tell. And if we sit down and maybe listen to the patient's story, we put the pieces together, we try to figure out where the breaks are, I think that is one big component that a lot of clinical staff doesn't have the time to do. So that would be one thing I would definitely recommend, as well as collaborating with different services and different clinical professionals, such as the community health worker, who has the time to sit down at the bedside, who knows the resources, might have been in that same situation, can empathize with the patient a little bit more. So I definitely think it's taking the time. We have to listen to the patient. We have to meet the patient where they're at. And I think as we model this, other people will learn how to do this, and then hopefully we'll all start slowly changing our behaviors and not judging patients.
The ideal world for me is that we're actually designing and we're actually creating healthcare that serves our patients, instead of our patients having to kind of just get plopped into a healthcare system that is no way, shape, or form good for them. It's something that I think would be very helpful for students, and not just med students, but all students, pharmacy, nursing, etc. It sounds cliche, and I swear I'm not drinking the Kool-Aid, but is actually to learn design thinking. It really is it empowers patients to speak their minds and give their opinions and tell the physician and tell the clinician what's wrong with them, and versus a mindset of just physicians trying to solve what's in front of them, like actually digging deeper and figuring out what other things the patient is going through.
Health justice for me, in 3 words, I would say would be advocacy, community, and equality or equity. In the last few years regarding health justice, we've seen some progress, more so at an individual or small group level, and those are the launching the community testing sites, providing more education for sensitivity with the LGBT community and racial injustices. However, I don't know that we're where we should 100% be. I mean, I think there is definitely markedly room for improvement, but I do think if we continue to work together towards it and keep making health justice at our forefront, I think we can make significant strides in progress.